or the commonest heart disease that probably most of us know, and most of us have a lot of myths about, and that is hypertension. Our attention today is going to be drawn more on hypertension, because this is really another silent killer, and very many of us have a lot of myths. And one of the myths is some of us who are a little skinny or slim or portable size, this is not our thing, and that is a very big myth that a doctor will demystify at the end of the show. So Raymond, make sure that you listen through very well, because you're one of the people who always for me, I don't have a protruding tummy, so I'm safe. Doctor, it's a good evening.
Good evening, Adrian.
We are glad that you're here again.
Sure. I'm really so happy to host me again. It's been a good day. Thank you for keeping a smile.
It can never fade.
And I want to assure you, a smile is a therapy.
Oh, wow.
So, please continue using it.
Okay.
It's really a therapy. And to even to our viewers, please keep the smile.
Okay.
Keep the smile. Give the people a smile. It's a feedback that you're happy. It's a feedback that everything is okay. It's a feedback that things will be fine, even if they're not fine. Amen. So, I like the way you do it. Okay. Continue doing it.
It's a pleasure.
Yeah,
How is the family at Gifted Hands?
Yeah, the family is so beautiful.
Okay.
We're doing our best to serve our people with a healing hand and with a soft heart that we serve beyond expectations. Gifted Hands is really doing its best to serve its community, and every day I'm glad that it's improving. It's going ahead. It's going ahead. Yeah, and we're trying our level best to serve our community in other areas. Actually, I would also want to take this opportunity to tell you I also happen to work with KCCA. Okay. So if I'm here and I don't talk about my bosses, I think it's going to be a big issue. But trust me, I'm really so proud that I'm attached to KCCA, and it has been a backbone of everything of my success. Okay. So, Gifted Hands, KCCA, big up. Okay. I really love it so much. Yeah. Thank you for hosting me once again.
We are glad that you came through. We are glad that out of your busy schedule, at least you've spared this. I could call them 2 hours. You've been here for the past 1 hour, and here we are into the next hour. So thank you so much for sparing these 2 hours with us as Church of Uganda Family TV. Of course, together with our family out there who are watching us. Doctor, we want to get straight to our discussion. And last week, as we were starting, as we were closing, we realized that we couldn't handle hypertension in its fullness and exhaust it. That's why we requested you to come back there, and we are glad that you came through. Just maybe to give a preamble and a summary of what we discussed last time, just for someone who wasn't here to connect very well as we get into today's discussion, because they want us to look at hypertension specifically.
Yeah, thank you so much. I'm glad to be here again to talk about cardiac diseases.
Yes.
And basically we talked about very many.
Yeah.
And because it's a really big topic, we could not really complete it in just one day.
Exactly.
So, and I'm glad that you requested me to come back and complete it. And thank you so much for giving me this opportunity.
We are glad that you accepted.
Sure. And for the same reason, we talked about different types of cardiovascular-related diseases, and even today I'm going to tackle on most of them just rapidly as we talk about hypertension. But the cornerstone of all cardiac diseases, most of them is related with hypertension. Okay. Mostly when it comes to Uganda, East Africa, Africa, even globally. And you realize if we can try to connect and calm down hypertension, at least we'll reduce cardiovascular-related complications and death by over 50%. It's a great manifestation. It's a great improvement in the health sector. And I'm glad that the Ministry of Health currently has really been doing its best to fight non-communicable diseases in conjunction with media companies. You people are doing a miraculous kind of work. You're really doing your best to make people get aware about non-communicable diseases. You realize that almost every family, just if you're soaking in a week, you lose like 3-4 people. What is the cause? If it's not stroke related complication, that's a complication of hypertension and other cardiac related diseases. If it's not that, it's a cancer. If it's not a cancer, it's a diabetes. If it's not diabetes, it's just an abrupt kind of death. Those abrupt cases you hear, more of them, 60-70% of them are cardio-related diseases. Somebody was sleeping, he died. You're going to hear some myths. He was bewitched. Last time he had bought a big flat or a big land.
The ancestors came for him.
Ancestors came for him. But surely, it's not that. It's not really that. Straight to the point. I think I have much to tell you about hypertension. To tell you about diseases, and still I'm going to still talk about most of the diseases that I talked about last time. But still, I'm going to talk about them now, but in a little detailed way, but more related with hypertension. By definition, I'm just going to make it as so easy for people to understand. Hypertension just means high blood pressure. High, as you hear the word high. Blood pressure. Most people always come say, no, so they found they have pressure. Pressure is not a disease. No, pressure is not a disease. Pressure was all supposed to have pressure. If you don't have pressure, you die. So, but the problem is it low or high? So when it's high, it becomes a problem. When it's low, it becomes a problem. In medicine, all things have to be in a balance. So if anything goes beyond the balance, then it becomes a problem. So that's how I can easily define it. Now, I'm going to talk about it in different age categories, in different people, how do you, and actually try to summarize, go even to treatment, and at the end, I don't always want to leave people in frustration. Give them a word of hope. Have we really failed as the medical sector in hypertension? The truth is no. Wait, at the end of the discussion, I'll give you exactly a therapy. And I'll also tell you that we can still join hands together to fight the disease together. So I'm going to go so much in the geriatric considerations or geriatric medicine. Geriatric means old age. You're going to realize the biggest percentage of people who are at a higher risk of suffering hypertension are old age. But this one does not mean that the young generation is not really predisposed to getting hypertension. I want to tell you, as I'm telling you, people in 30s, people in 40s, people in 20s, people in 18s have high blood pressure. It's unfortunate, but we can still do something about it. Ladies and gentlemen, hypertension is more as we grow. As we grow, there's a lot that changes in our body. Our muscles become, our blood vessels become a little hardened and thick because of the kind of foods we eat, because of other predisposing factors I'm going to talk about later. I'm trying not to empty my talk. But as we do that, we make sure that there's a lot that's actually we need to talk about. So the elder, if you know that you're at least 40 years and above, please go for a checkup.
What makes the elderly at a higher risk of getting, because this is now our old circumstance. As we were growing up, we grew up knowing that these were diseases of the old, of the aged. And although the narrative is now changing, but at least that was the common thing. And of course, you would find your judge telling you, and what does and so everyone feared to age because
because of that.
But what makes the old people are more exposed to this?
It's unfortunate that as we grow old, we get too much exposed to most of the diseases. And one of them is hypertension or high blood pressure. And why? Basically, as you look at their blood vessels, our blood vessels are formed of different muscles formed in proteins. Collagen, we have different levels, tunica, all other vessels that are within that parts that are really form the blood vessels. Now, as we grow, these blood vessels, which are elastic, most of the times we find ourselves becoming inelastic, not able to stretch well. So it means when the heart pumps blood vessels have high resistance in allowing the stretch towards the pressure that's coming from the heart. Now, what does that mean? Because when we are measuring blood pressure, we are measuring the ability on which the pressure, when the heart pumps blood, it puts some pressure for the blood to flow. The adaptability of the blood vessel to allow the pressure conveniently and stretch and push it again towards the peripheral or the lower parts of the body and other body parts. It's what we measure. Now, if there is a resistance, if the blood vessel doesn't want to stretch, if there is fat and the blood is becoming narrow, if there's a clot and blood is not flowing well, pressures increase. You get what I'm talking about. So in the process, that's why as we grow old, it becomes a bigger problem for the elderly to suffer that. I told you, Adrian, today you have a very small faith. 30 years down the road, 40 years from now, we shall have wrinkles here, we shall have this. And it's normal. It's normal. Why? It is telling you that your muscles are becoming weak. As they are becoming weak, their elasticity, this is what is keeping your skin a little well, stretchy well. It's the elastic part of it. Some of us, when we were still young, we used to put on a trouser that had elastic. As you go to play football, a colleague of yours puts in a finger, he pulls it and the finger goes. Now you realize you have to keep on holding it here so that you maintain, so that the things are not exposed. So in the process, it also happens as we also grow old. Blood vessels become so hard. So they lose their elasticity. Now the heart starts taking a lot of burden to pump blood towards its flow. So that is one of the reasons. As I still continue to talk about, so as I told you, still caution to our viewers, as you know you're above 40 years, please go and take blood pressure. And every time you visit a facility, make sure your blood pressure is taken. For the facilities, we always treasure so much triage. At Gifted Hands, triage is number one. You cannot enter a doctor's office if you don't see a nurse to take those triages, to know how is your blood pressure, how is your pulse, how is your temperature. He asks you about your height, he asks you about your weight, all those things. We are trying to curb the non-communicable diseases at an early age, and we try to prevent them from caution our patients that where you are heading, we are heading for doom. Do something about it.
You talked about height, and someone would really ask themselves, how is height related to non-communicable diseases? Yes,
as I say, height, basically, it doesn't have a direct relation with non-communicable diseases, but it helps us in taking your BMI. BMI helps us to know if you're obese, if you're overweight, and this tells us the risk you're on of getting non-communicable diseases. So height with your weight will tell you people who are a little taller have a better advantage, by the way, because they can at least accommodate some weight that when you measure their height and their weight, at least they tally, and you find that they are at a low risk of getting non-communicable diseases. As I will tell you that obesity is a risk factor. It's a very big risk factor, and which you must address. Most of the times you've had Ministry of Health, you've had facilities, you've had all people that actually all collaborating companies that collaborate with Ministry of Health in fighting non-communicable, they will always tell you, IDI has done that, associations of cardiologists have done that, physicians and all big facilities like Mulago Heart Institute has done that, and they really put a lot of emphasis on talking about obesity and fighting it, because currently it's retaking us. And why? Because of the things I'm going to talk about just shortly.
Okay.
Now, I just run a little through what I've prepared for these people.
Yes.
So, and it's through that you ask me questions where you feel that it's very important, and so that we can actually, our viewers can really get much to learn from what we are talking about. So, I told you that the elder are at a higher risk of suffering hypertension, and also what we are scared most. Hypertension, by the way, you will ask me, why are you scared about hypertension? You're talking about high blood pressure. Why? What does it mean? High blood pressure contributes very many significant complications that affect our important organs. And in the same process, your kidneys can shut down because of high blood pressure. Because every time your blood pressure, kidneys take a role in trying to control high blood pressure. Now, if pressure is not well controlled, nephrons die. Nephrons are the functional unit of the kidneys. Now, if you cannot excrete your waste products, what does it mean? The whole thing, the whole body will be at a mess. Every part of your body will be at a mess. And what the shown is, you will hear people looking for over 500 millions of money to go to India, to go to Nairobi, to go to Mulago for such a kind of treatments. For dialysis, whereby you find that you almost require a lot of money to go. We're glad that dialysis can be done in Mulago and Chiludo, but still, that's not the lifestyle you would wish to live. Now, let me tell you, prevention would be always the best thing that we should always embrace. Let's not wait for calamities to come and we start trying to fight them. The moment you actually try to fight calamities, trust me, you already are losing the battle 80%. Now, as I also take this time, I will always tell you that some hypertension is also associated with some drugs. People who take drugs like cocaine, there are some drugs, medical drugs, that can also predispose you to getting hypertension. You realize if they are said drugs put in a class called NSAIDs. NSAIDs are, for example, brufen, diclofenac. You've heard those drugs. They are not bad drugs, but if they are misused, they can cause a serious problem. So, such a kind of drugs, don't just run to the pharmacy or drug shop and always say, let the drug or let the pharmacist tell you that you require this drug. Don't tell me, I want this, I want this. No, tell them what the problem is. They will advise you on what really would be the best thing for you.
We are stubborn chaps. You even go with the money. I want ibuprofen of 300.
Yeah, sure. And trust me, it's something that we really embrace. And trust me, in pharmacies, we have qualified people there. Give them a chance to do their work. But if you come commanding, they will go give you what you want. But if you don't give them a chance to advise you, you are depriving them an important opportunity, also yourself. You are depriving yourself to good health. They would choose for you the drugs they require for you to do that. You also talked about, we talked about dwelled so much on elderly, but I want to tell the young generation is also suffering. Pediatric considerations. You don't think that young children do not suffer hypertension. Young children suffer hypertension. We recommend the Cardiology Association, the American Cardiology Association of Americans, and the Heart Institute in Mulago, or in Uganda, with the Ministry of Health. They advise that if you have a child and is above 3 years, it's a disservice to go to a facility and is not taken high blood pressure. Not high blood pressure, not taken pressure. Sorry, if I say high blood pressure, it's just a slip of the tongue, but it's pressure. So we've seen that pressure are always affecting even the young generation. These days, you find a child who is 10 years is having 50 kilograms. Trust me, if you don't take blood pressure for that child, you're doing them a disservice. If you're a doctor, if you're a nurse, and trust, and you're not really doing what is really supposed to be done for such a child, it's really a big disservice. Now, how do we define hypertension? Last time I told you about the the measures. Why do you say, which measures do you consider? Say, I have hypertension. I told you we have normal.
Yeah.
Yes, and which normal is about 110 to 120. When you are there, be comfortable that you are fine. When it goes 120 to 139, we call it prehypertensive. If we go to 140 out of 90 and 159 out of 99, we call that one stage 1. You go to greater than 160 to greater than 100, we call that one grade 2. Now, there's what we call resistant hypertension. Resistant hypertension is when you've tried drugs and pressure is not going down. You've tried this, it's not going. Be cautioned. I repeat this. Whenever you find yourself in such a kind of scenario, health workers, be so cautioned that you're using the right cuff for the right patient. You find somebody has a circumference which is almost like a thigh, and you're putting a pediatric cuff. Trust me, they will not get the right results. So pressures will come when they are very high. But what is causing that is actually using a wrong cuff. People have just arrived shortly, and they are just from running or they are from walking. You say, enter the triage. And you start taking pressure and you find it's like, you could be, no. When after doing some slight exercise, sometimes pressure goes high. When it goes high, it actually does not remain high. Give people at least 5 minutes of rest. Take their pressures. If you find them high, let them go see a doctor. As they're coming down, they're out of this anxiety, everything, take it again. When you find it high, give them another visit. Now, you do it 2 times in a week. You find it's high, taking all the precautions into consideration, you can now comfortably tell somebody you're either prehypertensive or you're hypertensive. It's very important. So we also talk about the pregnancy considerations. We've seen high blood pressure in pregnancies. I'm very, very happy about Ministry of Health. In August, it did a marvelous work trying to curb preeclampsia. Also, they're also talking about, they're actually trying, I think it was the following month of September, I think around that, where they brought in PPH. Yeah. But there's a month which was a month about fighting preeclampsia. They did it very well. There was a conference in Kawempe, there was a conference all over, most of the big facilities in Uganda. It was really well elaborate, and it was really given enough time for people to understand. And I'm really glad that media companies still are really going ahead to bring it every back and back and back, so that people keep on knowing exactly what the issue is. So every time you find you're pregnant, endeavor to go for your antenatals, mothers. I repeat this, mothers, Edrin, in Uganda, our mothers, our beloved mothers, we love so much. They go for antenatals at 6 months. They will tell you, for antenatal, are you getting me? And at that time, as a health worker, there's little or nothing you are saving. Because the earlier, the better. Taking folic acid is very important for the child growth. Mostly their brains and their central nervous system development. Now, all the 3 months we're supposed to take folic acid, you've not taken it. But you're holding a baby. And at the end of the day, those babies may get actually some abnormalities, and you say, and we are lucky. You know, there's a way God helps us, and I'm lucky that I'm in Uganda. And most times they have always said, doctors, you are liars. You say for us, when we do not take folic acid, we shall not. But you are lucky that most of the foods we eat have folic acid. Now, ladies and gentlemen, if you have dodo behind your house, please don't cut it. Use it for your good. It helps in curbing non-communicable diseases and hypertension, but also helps on us that actually who were born from somewhere else, but mostly you found our mothers took folic acid. in a different version, not in a direct version.
We are taking a short commercial break, but when we return, talking about what pregnant women eat. What about those who eat soil that is around the latrines? Anyway, we shall come back after the break. Please stick with us.
This is Church of Uganda Family TV, enriching lives.
Welcome back from that short break. Indeed, it was short, and here we are. We are back. This is Family Hour. You who is joining us for the first time, of course, this is the second part of today's edition of Family Hour. Edwin Austin Mukalas is my name, and we are looking at the burden of cardiovascular diseases or heart diseases. But specifically today, we are concentrating on hypertension because this is the commonest, and some of us ignorantly said, Nina pressure. Doctor told us that everyone has pressure, but it is either high or low. Then that is when we can say that you are in danger. Doctor, before the break, you were talking about the pregnant women being at risk, and you also talked about preeclampsia and those other conditions that surface when women are pregnant. I think we can pick it up from there.
Yeah, thank you so much. I was still talking about the pregnancy consideration.
Yes.
Is it true that a pregnant mother does not suffer hypertension? The truth is, our mothers suffer hypertension. And for that case, being the mothers of the country, being the precious mothers who delivered us and put us into this world, we treasure them. And for this reason, I take this opportunity to say, mothers, go for antenatal. I repeat it once again, mothers, go for antenatal. Actually, it's better even when you are planning to deliver next year. Go and check on your doctor. It's even advised to begin folic acid even before you conceive. It's very important. It's important for our babies, important factually, mostly for our babies. Now, hypertension, go back to the point of hypertension.
Yes.
Pregnant mothers, we have 3 types of hypertension that we really see. We have chronic hypertension for mothers who already know that they have hypertension. And for that reason, we always find ourselves controlling it. And when once it's controlled by an obstetrician and physicians, it's always better. You find it's well controlled, and we deliver a very healthy baby. And even our mothers remain healthy without any complications. Secondly, we have what we call pregnancy-induced hypertension. For some mothers, you find that it's pregnancy that comes in pressure goes high. They will always tell you they have been always not hypertensive, but when they got pregnant, they found themselves, when they went for antenatal, they found themselves having high blood pressure. And for that reason, I take it from there that those mothers are at a higher risk of suffering complications of hypertension. So go and see your doctors, ladies and gentlemen, so that you can actually curb hypertension at an early age. And I want to tell you that pregnancy induced hypertension, after delivery, it goes. Come back to normal. So that shouldn't be a big worry. We have one worry that actually Ministry of Health has really put a lot of emphasis in fighting. That is preeclampsia. I'm repeating that preeclampsia has taken most of our mothers' lives. Just I think 2 years back, one of the our MPs died before even reached Case Hospital. For those who read papers, you know it. For the lives that we lose that are not shown in papers, not shown on social media, are the biggest number. But I'm glad that health workers are really doing their role in curbing that. Ladies and gentlemen, don't be scared of hospitals. In hospitals are not your enemies. Actually, they should actually be your friends to bring your health back to normal. Most people really want to hear symptoms. If they don't hear Antunus, like seeing their dresses or their coats moving, they don't really go to hospitals. Not until they get such a kind of symptoms that they think of going back to hospitals. Now, preeclampsia can be controlled, and we deliver our babies well. When it's necessary, we always want to remove those babies earlier. And I want to tell you that in most facilities, especially in Kawempe, we have a well-organized team. We have neonatal unit, trained obstetricians and neonatologists who work on those little babies who are born preterm, and also to work on the mothers, including, not forgetting, a team of physicians who are really cardiologists, who are really good in fighting such a kind of complications. So don't be scared. Go to facilities. Go to facilities and get the right treatment and all what you need to get for hypertension. Epidemiology, last time I had told you slightly about it. Basically, just to make it simple for our viewers, that if you count 1, 2, 3, 10 people, you can't imagine 1, 2, 3, 4, 10. Among the 10, there are 3 to 4 people who have hypertension. Anywhere you go for a wedding, if there are 500, count 1, 2, 3, 4, 10, go there, take their pressures. You'll find not less than 3 have high blood pressure. It's a big burden. It's a big burden. So, it's really a threat. Globally, Africa, East Africa, and Uganda, our motherland, what we call the Pearl of Africa, which we love so much. But I'm telling you that we're so lucky that God gave us almost all what He requires to fight it. What causes high blood pressure?
That's the thing.
Some people are saying, Doctor, bilwadde by'abazungu. Bilwadde by'abazungu. Eno tebyaliyo kati bwe mwateekamu oluzungu lungi ne bijja. No, this disease used to be there even before, when our medicine tried to improve. But the only thing is, diagnostic tools, all things that we use to detect early diseases, they are all over. Blood pressure is actually a free thing to do now. You go anywhere, you drink, and they say, do for me blood pressure, they will do it at a free cost. Now, because they are so common, now even diagnosing it becomes so easy. You find that most of the time, when you go on facilities, the first thing they will do blood pressure. And that's how we get them. And that's why they are really so common these days. So, ladies and gentlemen, it's not actually doctors and health workers that bring hypertension. No, these are the things that cause hypertension. One, I want to make it so clear that 90% of people who have high blood pressure, we don't know the cause. Yes.
How is that possible?
It's possible. It's really possible. Why? Scientifically, we need to say, this is, if Mukala's being here, you are the one on Family TV. But as we go ahead, as Uganda Heart Institute and the global cardiology associations have tried to link several factors to hypertension with scientific evidence that if these things are put forward, pressure goes high. Now, we try to link on that to be the cause of hypertension. So why does this one leave us? That actually, it does not leave us helpless. No. There's something that we can do about it. And we curb it. Now, 10% of hypertension is secondary. Is where we find that we cannot the cause. 10%. Whereby we find that somebody has a renal disease or a kidney disease, pressure go high. Because kidneys play a role in fighting or in controlling blood pressure. So if anything goes wrong about them, pressure goes rampant. You get me?
Yes.
2, you realize that most of the biggest factor or things we ask when you go to hospitals, family history. If your dad and your mother have high blood pressure, today or tomorrow, it may be daytime or night, you know that at one time you may get high blood pressure. Very important. So do not really think this is a curse. I want to make it clear, ladies and gentlemen, and our dear people, the people in their side of medicine, we call the herbalists. I really love them so much. We do a lot, and those people are really good at giving assurance. And where actually
people trust them
so much. And the reason is they're very good at communication. Doctors, ladies and gentlemen, to my colleagues, ladies and gentlemen, for all other fraternities that actually educate doctors, let's embrace communication. Our colleagues have really done that part. And I really don't really say that what they do is not good. Of recent, they've really approved drugs by NDA. I saw you showing them in papers.
Yes.
It means they're doing some good work. But sometimes they give false assurance to people of healing because that's what people want to hear. And you find at the end of the day, it's affecting the community and the community at large, whereby there's no enough scientific evidence to prove what they're saying. Now, and how does it end? For us who are on the other side, you realize that most of the people we have with complications are rated with hypertension or poorly, because they will tell you, I've been taking herbal. I've taken herbal for this time. It was getting better, because all what we want to hear is that word of hope. I'm getting better. I'm becoming fine. You will be fine. That's the word we want to hear. But sometimes you need to hear the right word for you to live a better life. I want to make it a little faster. Last time I talked about obesity. I will not take a lot of time about it. Obesity, it comes with eating poorly. Of recent, I want really to applaud Mulago Hospital and the nutritional people, Dr. Kamara and the group. They have really done a great work in retelling about people how to eat well. There are very many webinars we've really joined to tell us on how to eat every day. Thank you so much to do that work. It's a great work. And trust me, once we continue like that, we're going to get a better Uganda to live in, with less comorbidities and even death. Alcohol, I emphasized last time, I don't know where you were known. People were almost killing me that I pressed the wrong button. Surely, my friends, I don't intend to press the wrong button. But as a medical doctor, when I take the oath, I said I have to speak the truth and nothing else but the truth. For the best of and for the best of my people, I will always say the truth. So, alcohol, overconsumption of alcohol, predisposes us to getting high blood pressure. Last time I elaborated a little more that Then also what we call excessive dietary sodium. When I say sodium, people will not understand me. I'm talking about salt. Let me give you one just simple story of recent. My beautiful auntie, well, not mention the name here. He called me early in the morning. Like, I know you're going to get so busy after the afternoon. Now I decide to call you now. Now, when I call you at this time, I want to ask you something. Somebody has told me that when I get a pack of salt and I cook, I put it on top of food, that pressure won't go high. I'm making it clear as I'm facing you people. This is the answer I told her. The problem is not about cooked and uncooked salt. The problem is salt. The amount of salt you take. The recommended salt is 2.4 grams of salt. How do you measure that?
Exactly, that's the question.
How do you measure that? It will depend on the amount of food you're cooking. For big hotels, they know how to make those things. But at home, in your so small, make sure that when you put, and you make sure when it's not really too much, you really, that one that really feel it's not much, don't add in salt. At least let it get some tasty. I will not tell you that put this number of spoons. I will mislead you.
We just put into our palms and then pour.
Our wives and our mothers are really talented in doing that. You already that their food is tasty and you feel it's really delicious. Don't add in that. But some people have a tendency of adding this. It's dangerous. That kills your kidneys, that brings heart diseases, that raises pressure, go high. If you've ever done an experiment, get salt, put it on a table, expose it outside, leave it there. You realize in the morning it's covered by water. Yes. So when you eat it and it goes into your blood, salt drains water into the blood vessel. And what does this one do? When more water goes into your blood, it increases more burden to your heart. So what are we trying to do? You're increasing what we call the cardiac output. The amount of blood you're going to push outside is high. Your heart is already suffering, it's telling you, I'm really helpless here. Help me. Then the only help you can give them is to add more problem. No. Somebody tell me these things are heavy for me. Instead of then you say, add on more. You're killing that person. Just and simple in a layer language, that's how I can explain it. Stress is a big killer. I will still want to take this opportunity. I have a friend of mine. I'm not scared of telling him or talking about his name because he's really one of my mentors. Dr. Dokonyero and Dr. Dr. Carol. They work in Mulago, in the psychiatry department. They're my friends. They told me whenever you get time to talk on air, tell them that we have stress. People are dying of stress and nobody's attending to it. Ladies and gentlemen, the much power we put in fighting non-communicable diseases, stress is also a non-communicable disease. And where we are being given this false impression that we need to just let it be the way it is. No, it's not. That will be another topic of another time. Tobacco also causes heart-related diseases. It also makes our blood vessels harden. As I told you, that as we grow up, blood vessels harden. This time tobacco makes it more. Now, even if you are young and you are really a good smoker, chances are high that tobacco is going to harden your blood vessels and you get cardiovascular diseases, what we're talking about as hypertension or pressure being high. Inactivity. These days, once they find you running, I'll have more for you. If you are moving to work, they say he doesn't have transport. Now, ladies and gentlemen, our communities, stop the stigma of failing people to move. Let people move. In COVID, we moved. And trust me, it was good. And I liked actually the culture that COVID brought in us. However, it was for the wrong. I'm not praying that COVID was good. But somehow, we need to look into good things that it did. People started riding their bicycles. Yes. People could move. Exactly. People exercise. Yes. I have friends of mine that move move. They move. And trust me, it has really done incredible things. When you move, you actually reduce a bigger percentage of these cardiac-related diseases and hypertension. Insulin resistance, this is related with diabetes, and also finding that you are fat, obesity. You find that your body it's not receptive to insulin. Insulin are these proteins or cells that help to carry glucose from blood to cells. So if your body is not receptive to them, then trust me, non-communicable disease, hypertension comes, blood pressure diabetes comes. Blood pressure and hypertension, they're already sisters and brothers. They move together. I think you've already heard about that. Yeah. Now, how do you diagnose hypertension? How do you diagnose that? I told you, number one thing is triage. Just as simple as that. But we take history. People always come complaining of headache. I'm making a point. You have headache, and it's mostly at the osput. Here, we call it the osput. In Uganda, it's called enkona. In Onyango, you call it enkomo. Those kind of words, people understand them better than telling osput. Osput, these are scientific words. They will not understand them well. Now, you are bad, you always feel your headache is always here. Go and see a doctor. Don't take it for granted. Chances are high, it could be a sign of hypertension. Okay. You are there and you're feeling headache, or it's not going all over your body, all over your head, frontal, temporal, parietal, anywhere. It can be a sign of hypertension. People come with palpitations, what we call in tunus in Uganda, or when you hear you feel your heart is racing. People come telling you, I'm feeling my heart is racing. I don't know, doctor, if I'm sleeping, I can listen. Normally, you don't have to have a feeling of your heart. No. Just be there and you start feeling that your heart is racing, it's abnormal. When you feel it, please be sure that actually there could be a problem. Laboratory investigations can be done as a doctor realizes according to the complications you have. In that same process, he can tell you that maybe hypertension has caused this complication. This is what we call stroke. You've heard about them. Yeah. You've heard about retinopathies, the eyes getting affected by hypertension. People who are hypertensive, they will always go and see their opticians or doctors of the eyes to check on their retinas to see if there are hemorrhages or if there's any complaint. They will tell you, I'm not seeing well. I'm saying things I'm not seeing well. Maybe it could be a sign that you've actually gotten a retinopathy, hypertensive retinopathy. There's also what we call hypertensive renal disease, or else cardiomegaly. Last time you asked me about people who have enlarged hearts. Yes. It's a complication of hypertension. Just as you go to gym, the more you carry, these biceps, these muscles grow. The same thing. Your heart is doing a lot of work to push that. It's finding resistance. In the same process, your left ventricle enlarges. And when it enlarges, it causes what we call cardiomegaly. Cardiomegaly is a sign or a complication of untreated hypertension. In the same process, doctor, you're telling us of a lot of complications. You're scaring us. Is there a hope for us?
Who is safe?
Yes. Who is safe? Who is not safe? Ladies and gentlemen, they will do your physical exam. They find and doctor tells you you're obese. You are not safe. You're a person who is a smoker. You're not safe. You're a person who always want to kuduga zemeza. In quotes, people who take a lot of alcohol, you are not safe. People who always find exercising as if it's for the poor, you are not safe, my friend. People who always have family history of hypertension, ladies and gentlemen, you may not be safe.
Where does our hope lie?
This is where our hope lies. One, we have preventive measures. Okay. And I'm going to take a little more time, just in a short minutes that I'm remaining with. There's some research that have been going around about what we call complementary medicine, while relaxing, exercising, yogas, and using of food supplements like garlic, to see maybe if they can curb hypertension. They can prevent hypertension, but they don't cure hypertension. I'm repeating it. Garlic is a very good spice. Foods are good, but they don't cure hypertension. I'm still going that. There's what we call the DASH diet. DASH diet, it means dietary foods that are used supplementaries to curb hypertension. Where do we fall? Let's rush for eating vegetables. 50% of your plate should have vegetables. Actually, if you can actually really do it well, have a separate plate of vegetables. Before you make your stomach full of these highly spiced foods, first eat those ones. Then eat the other ones. At least the other ones remain. You will fight hypertension. For people who have already risk factors, as the one I talked about, eat a lot of vegetables. Make it a rule. Make your children love vegetables. Fruits are very important in that. Whole grains are very important. Fish is very important. And poultry, meat is very important. This does not mean that you shouldn't eat red meat, but at least minimize once a week, twice a week. Let it not be everyday thing. Eat beans. Beans are not for the poor. Greens are not for the poor. Fruits are not for the poor. Ladies and gentlemen, very, very important. Eat those things.
Okay.
I want to take this opportunity still to say the webinars are really doing a great work in encouraging us to do that.
Indeed.
These things do not only fight hypertension, but all other communicable diseases, including cancers and hypertension. In this process, if you find yourself sick, mostly in the first ages, we do what we call lifestyle modifications. Do what I've told you. Eat well, exercise. Keep your body in shape. You will look smart and look very handsome and beautiful. If you find you're already sick, go and see your doctor. They will always choose the best drugs for you.
Thank you so much, Dr. Boaz.
Yeah.
Wow, thank you so much. I know the questions would have been many, but because of time, we can't go beyond this point. But I believe that this was even enough, and at least it was giving us a clear insight of what hypertension is. Now, from now, we all know what to do, what to eat, what to minimize, and things like that. Thank you so much once again for coming through. Edwin Austin Mukalas is my name. We thank so much Dr. Boaz for coming through to take us through this discussion. I've worked with Tonena Raymond, Didmas, and very many other people that make sure that you have this broadcast. And from the entire team,